Dr. Lewis talked about the people who know what it's like to be there every day. And I want to ask Myrla Baldonado to come up. Myrla is one of the people who know. She is a domestic worker leader from Chicago. She has been organizing domestic workers with the Latino Union, and she has worked as a caregiver in private homes of seniors for the last 5 years. Before that, when she was in the Philippines, she organized as a human rights leader. So Myrla, will you share your story with us about being a home care worker?
Good afternoon, everyone. I am Myrla Baldonado. For the last 5 years, I have worked as a caregiver in the private homes of elderly patients in the suburbs of Chicago. I am paid $110 per day to work a 24-hour shift. I currently work 4 days a week, and that amounts to $1,760 a month, but it's less than $5 an hour. I have been a caregiver for 20 seniors. Some have been unable to walk, others have dementia, 2 had Parkinson's disease, 3 had survived stroke, 1 was in hospice care, 3 had mental problems, and 1 had a brain tumor. I do many things to support the people I work for. I give them sponge baths twice a day, and once a week I bathe them. I assist them in transferring to the commode and assist in the bathroom. With some clients, I have used a Hoyer lift. With others, I have done it manually. I cook their meals and feed them and ensure that their medicine is taken on time. I do housework including making beds, doing laundry, washing dishes, and cleaning. Often, I'm asked to communicate between the family and the medical team. I also log daily activities, make lists of things for the family to buy or order from the pharmacy. I keep track of medications, encourage them to drink liquids, do range of motion exercises. In at least 2 situations, I've also taken care of the granddaughter of a patient and the husband of a patient. I also train other caregivers and relievers on the routine and do other work required by the family. I like being able to care for another person while earning money for my own survival and that of my children. I take pride in my ability to persevere under the worst circumstances, battling loneliness, isolation, and being humiliated. I have been verbally and physically abused many times by patients or family members, and I've been sexually harassed. I received training to become a certified nursing assistant. However, every patient needs different types of care. There should be continuing training to ensure the quality of care, and in order that caregivers don't carry the burden of figuring out things by themselves. Once the patient is discharged from a facility, most caregivers are left on their own to figure out how to take care of the patient. In a recent job, I worked with a woman who has pulmonary disease. I had no experience at all with this type of case. It was only after a couple of months that I realized certain things that I should have known before I started to care for this person, like the proper use of the oxygen tank, proper management, monitoring, and emergency measures when the patient is having trouble breathing. We need laws to regulate the home care industry. Workers in home care have the same rights and worker protection as other workers. We should not be excluded. We should be able to form our own union and become members to negotiate for better treatment by the agencies and the families that employ us. Working in a private space without a contract that carries protection of caregiver rights subjects us to the whims and caprices of the client and the family members. That is not right. We deserve more respect. We deserve more respect. there was better regulation and more training for workers, the quality of care that our patients receive would be improved. It would benefit all of us. I do not receive any benefits or any paid sick days. In fact, I am classified as an independent contractor. This is an irony pointed out to me by a labor lawyer. I am an employee of an agency, but misclassified as an independent contractor for the agency to get out of paying me minimum wage, workman's compensation, overtime pay, and their share of my Social Security and other payroll tax payments. If we want to improve the quality of care, it is important that undocumented workers have a path to citizenship. Without immigrant workers, it will be impossible to have enough workers to care for the growing number of patients who will need home care. I have seen documented workers persevere in the worst situations, treating their patients like relatives and even lengthening and saving their lives in many instances. They deserve to gain a path towards citizenship for this valuable service to America. I think I should be paid like other workers. I should be paid the lawful minimum wage, and I should be paid for overtime work. I should not have to work 24 hours shifts, and I should have a contract that protects my rights. I should be able to join and form a union and be able to air grievances and recover from losses to my dignity and self-esteem. Caregivers like me should also have a path to citizenship so they can continue to care for this country's elderly and for people with disabilities. I believe that we domestic workers should lead and become active part in the building Caring Across Generations network. This campaign is a very comprehensive proposal and solution to the unregulated industry that is in many ways uncaring and so driven by profit motive. It is an opportunity to work hand in hand in alliance with the families, the disabled, our patients, to change and to be treated fairly and with dignity. And when these changes are made, you and I will be able to take care of our own health, our children's health, and become a better caregiver to our clients. We will be able to use and further utilize our potential in providing home care. We will also be able to help other caregivers who aspire and dream for the same improvements. Thank you for your attention.